You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome. I'm Patti Tripathi, the host of Breathe Easy for the American Thoracic Society. Joining us are Dr. Hartert, who is co-chair of the American Thoracic Society's vaccine initiative. She's a professor of medicine and pediatrics at Vanderbilt University School of Medicine. And not too long ago, I spoke to her about the measles vaccines and the outbreak in Texas. Thank you, Doctor, for your time. And also Dr. Ryan Maves. He's a professor of medicine and anesthesiology at Wake Forest University and an attending physician on the Transplant Infectious Diseases Service and as chief of the Division of Critical Care Medicine. You, Doctor, are also a vaccine researcher and vaccine advocate. Both of you, thank you for your time. A federal judge, Dr. Hartert, has stopped a plan to revise the nation's vaccine recommendation for children. Please give us some background on the big victory in a lawsuit brought by 6 medical groups who are trying to promote a science-based vaccine schedule.
Yeah, thanks for having me, Patty. It's a pleasure to be here. Yes, the AAP brought a lawsuit against RFK Jr. for a number of reasons. The first was for replacing members of the Advisory Committee of Immunization Practices, or what we call the ACIP, for subsequent changes made by the committee, not based on a transparent process or based on data, as well as changes to the COVID-19 vaccine recommendations. And what the AAP really specifically alleges is that federal health agencies who are charged with making recommendations for the health of the U.S. population failed to observe what are required procedures and acted arbitrarily and capriciously in making the new recommendations. These new recommendations were blocked blocked by a federal court based on this lawsuit.
And you had a terrific quote in the New York Times, Doctor, and it says it was a reckless as letting a group of amateur pilots dictate how our airplanes should fly, and the stakes in both scenarios are life and death. Expand on that, please.
Yes, this really feeds into one of the alleged problems in this lawsuit, which is a transparency around how experts are selected to serve really the American public in terms of making recommendations about our health, and that is vaccine policy. So there's a lack of transparency around selection of individuals who are making these recommendations, and a lack of transparency and operations, as well as public involvement in making the new vaccine guidelines.
And Dr. Maves, the vaccines that they were recommending have been reduced from 18 to 11. Are the remaining really crucial for critical care medicine?
Well, so in terms of the ones that have been reduced, if we're talking about the childhood vaccine schedule, I do like to always preface to say that I am not a pediatrician. But some of them include some vaccines that have had a major impact on public health. And I think one of the big ones are the changes to the hepatitis B vaccine, which effectively has changed hepatitis B among U.S.-born infants to a non-existent disease. Part of the model was looking at kind of economically peer countries, which have different policies, but those countries also have much higher rates of good prenatal care, much higher rates of prenatal Hep B screening for pregnant women. And so our national response to this was, let's just vaccinate all children against hepatitis B, an extraordinarily safe and effective vaccine, and it's worked. That is just one of many examples, but I think that is probably the one that's on the top of my mind. in terms of how they directly relate to the ICU, certainly it directly relates to the outcomes of children and newborns requiring critical care. Again, not my personal area of expertise, but as a father, I certainly made sure that my own children were vaccinated, and I would encourage others to do the same.
And the vaccines that were eliminated were hepatitis A, hepatitis B, RSV, dengue, and 2 forms of bacterial meningitis. As time goes on, there have been changes. For example, in 1970s, smallpox vaccine was done away because it was eradicated. This is not the same format where Dr. Hartert that polio should not be given or COVID should not be given, because really it's our children affected by COVID, or are those who are immunocompromised or seniors that are affected by COVID. What is your response to that?
I think what's important to recognize is that these new recommendations have not been based on any available data to suggest that the vaccine guidelines should be changed. And I think more broadly, what we're really facing here is chipping away at trust in vaccines overall and decreased public understanding, actually, of the importance of immunization and acceptance of evidence-based vaccine recommendations, which are absolutely critical to protecting child public health, our patients who are in the ICU, family members. So when we vaccinate, we're protecting individuals and we're protecting populations of patients as well. And as Dr. Maves pointed out, our population is tremendously diverse, and we don't have healthcare for all persons in this country. And we cannot compare ourselves to other high-income countries in choosing to do and put in place vaccine guidelines for other countries. So I think more broadly, as I said, we're facing this decreased public understanding and trust in vaccines. And it really stems from 2 things that are happening acutely. And the first are these confusing changes to the vaccine guidelines, which remove some or change to a shared decision-making domain, which really makes it sound like these are optional vaccines. And I think the second, and that has been blocked by the court, at least currently, but the second is really repeated comments by our Secretary of the United States, who has a decades-long history of promoting what have often been debunked claims about vaccine safety, which has been framed as pro-vaccine safety, really, rather than anti-vaccine. And I think currently both of these things are really decreasing acceptance of and chipping away at trust in vaccines overall in our country.
And what is the American Thoracic Society's role in this lawsuit? And it's probably going to be going to the Supreme Court.
So the ATS signed an amicus brief as part of the lawsuit from the American Academy of Pediatrics, or the AAP, versus RFK Jr. And this is a legal document that we had input into that's submitted to the court by organizations like the ATS and others that provide very specialized expertise to the court, including what are alternative legal arguments, information on the broader health and social impacts of these vaccine preventable diseases on the patients that we as ATS healthcare providers serve.
And Dr. Maves, you said that you are not a pediatrician. You are also concerned about the staff that is in critical care. Please tell me more about that.
Yeah. So when I think about my own practice, there's sort of 2 things that I do for a living. One is I care for immunocompromised patients at risk for infection following organ transplantation or with leukemia, lymphoma. These are people who depend on those around them to be protected. Their response to vaccines are diminished. In some cases, they cannot receive certain vaccines, particularly live virus vaccines. And so they really depend on a highly vaccinated population to keep them safe. Right. And this is not a new concept in vaccination. I'd give the example of the rubella vaccine. Rubella in an otherwise healthy man is a mild disease, right? I will be fine. If I transmit rubella to a pregnant woman, that newborn will have, is at risk for a lifetime of congenital abnormalities and needs for medical care, and it can be a devastating infection in that setting. I am vaccinated against rubella so that I do not give a pregnant woman rubella, right? This is a well-established concept in public health. And I think that concept is something that gets lost. And you spoke a bit about trust in vaccinations. And what I would say is this: I will admit a certain irony to the current HHS leadership talking about how they're there to rebuild trust in vaccines because the public has lost some of this trust. That is not unlike an arsonist telling you should have done a better job keeping your house from burning down. That some of the advocates on the side of the current HHS secretary are largely the people who have worked to undermine that trust.
I'm excited to introduce a new benefit. ATS Now is a multimedia platform that's AI-driven and allows you to search ATS content for what you need to learn about and know more, whether it's ATS conference material or webinars, etc. It's really tailored to your needs and when you need them. It's like Netflix for pulmonologists.
And there were claims that autism is caused, autism is ballooned.
Yeah.
That autism is caused by the increase in number of vaccines.
Yeah, an absurd and unsupported claim. And to the extent that there is data, that data is negative. In fact, there was some evidence that, for example, MMR vaccination in, I want to say Finland, but in Northern Europe, actually led to reduced rates of cognitive challenges among children, which makes sense because there are neurologic implications of a lot of common childhood illnesses that people forget about because we haven't seen them for years, right? And unfortunately now we're relearning what, for example, measles can do. And when you look at it from a broader public health standpoint, the measles vaccine is a great example. After primary measles infection, there is a loss of memory B cells. There is a loss of immunologic memory. So children or adults who recover from measles are more susceptible to infections in the future. Measles vaccination reduces all-cause childhood infectious mortality, and that's been demonstrated in country after country after country. So the burden here is extraordinary. When you talked about the ICU, obviously I want people to not need me. I want people to not suffer from critical illness. And I think, as most of us who worked in ICUs during the pandemic can say, what I did not have was an ICU full of vaccinated patients on the ventilator. I had an ICU full of unvaccinated patients who were critically ill and in very many cases died. I do not have a practice where I see a patient suffering from the complications of vaccines. Now, vaccines are drugs, and drugs have side effects, and we do need to be candid with patients about that. I warn people, hey, after you get your shingles vaccine, don't make any plans for the next day. You're going to feel a little wiped out, right? But the day after that, you'll be fine. And we can be candid with people about that. We can tell people, sometimes you will have a transient side effect, which will be short-lived, and from which you will recover shortly. It is better than the alternative, which is severe influenza, invasive pneumococcal disease, measles, you name it.
Dr. Hartert, the Pediatrics Academy has issued its own immunization schedule. People must be very, very confused about what their child needs, to go to school, or what is covered by insurance. So if they're confused, where should they be going?
That's precisely why the American Academy of Pediatrics actually came out with its own vaccine recommendation guidelines, because what the new ACIP released were confusing. They were confusing to parents, to clinicians, pediatricians, the general public. And second, they were not based on or driven by any new available data. So the AAP has been a long trusted source, and then for decades actually has issued its own vaccine recommendations, which have generally been completely in line actually with the ACIP. but there's a need for trusted and data-driven recommendations. And so that's why the American Academy of Pediatrics, or AAP, released these guidelines. It's also why there's a multi-society effort underway from the ATS and a number of our sister organizations to review the processes of these organizations from our sister societies and endorse appropriate guidelines for exactly the same reason, so that the practitioners, so we as practitioners who take care of patients with pulmonary and critical care and sleep conditions, actually have data-driven guidelines that can be trusted. And our patients can go to our ATS website or our guidelines and access these same data-driven recommendations that the American Thoracic Society and our sister societies endorse.
And could you give us the schedule? Do you know offhand what is recommended? And it mirrors the previous CDC recommendation, correct?
You mean are you talking about the AAP guidelines?
Yeah.
So the AAP guidelines largely mirror the prior ACIP guidelines prior to February of 2025.
And the acronym stands for ACIP.
AAP is American Academy of Pediatrics, and the ACIP is the Advisory Committee on Immunization Practices. And this is a group that's convened and vetted by the Centers for Disease Control and Prevention, our national public health agency, who has an extremely vigorous process in the past of identifying non-conflicted individuals with vaccine expertise to serve on this committee. That process is no longer in place for the selection of the new individuals who replaced the 17 individuals who were previously served on the ACIP, or the Advisory Committee on Immunization Practices.
Okay, so do you expect, while there's a stay, that this is going to be appealed by the government?
I can only speculate, but I assume, and I think it's been stated, that they plan to appeal this decision.
Okay, a lot of confusion. It's going to cause, again, so the case may go to the Supreme Court. And recent survey from the Annenberg Public Policy Center at the University in Pennsylvania found that trust in public health agencies has declined. And you obviously are trying to reverse that.
Well, I think, yes. I think it is interesting to look at that Annenberg review, though, because in part, when they survey that differing groups have decreased trust in public health agencies, you're getting two ends. You're getting one group of individuals who may have never had great trust in CDC and other aspects of our kind of national public health infrastructure and public health leadership. And then you also have people who are vigorous advocates of public health. Dr. Hartert and myself, for example, who lack confidence in the current leadership of HHS and CDC, while nonetheless being extremely supportive of the mission of CDC as it historically has been. And so that survey, there's a granularity there that I'm not sure has been totally addressed.
And I'd just like to add to Dr. Maves' comments, I think the one thing that has not been tremendously eroded, while there may be some erosion of trust in public health, I think there's a lack of understanding about public health, but there hasn't been significant erosion in the trust in patients' healthcare providers. And still, healthcare providers, and particularly subspecialists, are often patients' most trusted source of information. And that's why it's critically important for providers and patients to actually have clear vaccine recommendations and guidelines from trusted sources.
Okay, this may be repetitive, but talk about the multi-society effort the ATS is engaged in to promote science-based vaccine schedule.
So there is a multi-society effort going on within kind of the respiratory society consortium, if you will. This would include ATS, obviously, includes the American College of Chest Physicians, Society of Critical Care Medicine, and I'm always going to mangle this name, but the American Academy of Allergy and Immunology. I believe that is the fourth one. And the effort behind this is partly to see what can be done in terms of endorsing existing guidelines that our other colleagues in other areas of medicine are producing. Partly it's to see if there is a role for a specific guideline process, which is a very complex process, originated within our group. And then also looking to see how we can support other pro-vaccine organizations. The Vaccine Integrity Project at the University of Minnesota, under the leadership of Dr. Mike Nosterholm, is a great example of a way that, in a way, sort of civil society and academia are coming together to fill this void that has been created by recent administration actions. And so that's ultimately the goal. Dr. Hartert, did I leave anything out there?
No, I completely agree. I would just say I think we all feel that it's really unfortunate that this has to be done.
Yeah.
And that the new ACIP is no longer considered a trusted entity that follows a transparent process by both the ATS and numerous other professional societies and healthcare providers.
Okay. Dr. Hartert and Dr. Maves, thank you so much for your time. I know you have a very busy schedule, and it's greatly appreciated.
Well, thank you for the opportunity.
Wow.
We really appreciate it.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.